success as well. We're currently quite a very happy city as well. If you are not aware, one of a big part of our identity is our local football team, and for the first time in 70 years, we won our first cup. And this was just about 2 weeks ago, where we had a big parade within the city, and that was about 300,000 people come along to celebrate this latest success. And again, so I suppose it's a very kind of community-based city, and again, very, very, very welcoming on the whole. So at the moment, we're all really quite happy at the moment, which is good. And then ultimately, I think one of the nice things that we'll have about Northumbria, within Newcastle, is that it is the home of Northumbria University. So where the picture is taken is about 500-600 meters away from the centre of our university here. And Northumbria is always kind of continuing to improve and develop. In 2022, we were voted as University of the Year. And in this current year, within the Times Guide, or the Good University Guide, we are now Modern University of the Year as well. So we're quite successful in what we are doing on a national basis, but also on an international basis as well. A bit more specific to physiotherapy, this is data for our BSc program, which is slightly different to the MSc program, but a lot of the taught content is, in terms of concepts, is very much the same as the BSc, and it's the same staff that deliver both the BSc and MSc programs here at Northumbria within the same facilities. So we have a good track record of doing well in terms of national rankings. Currently, the BSc program is ranked #1 according to the Daily Mail just last year. In terms of the Times Higher Education, we are 4th in the UK, and then in the University Guide, we are 8th in the UK. Certainly, in terms of research, we are quite a strong department as well. It's a big part of what we do with physiotherapy, and are currently 6th. Our department for which we sit in, physiotherapy, sits with sport, exercise and rehabilitation, and that was ranked in Ref 2021 as 5th within the UK. So we are, in terms of very successful program with a long track record of being successful. Part of that is some of the facilities that we have. The pictures that I've got on here is Coach Lane campus. So our healthcare programs are delivered about 4 or 5 miles from the city centre in a place called Coach Lane campus. There's a free bus that will take you from the city campus towards our campus. We have some excellent library facilities here. And then on the bottom there, you can see the Clinical Skills Centre, where we utilise a lot for our teaching and for both the BSc and, of course, the MSc physiotherapy program, for which you are obviously interested in today. And just because of the cohort sizes, we typically use the Clinical Skills Centre a lot for the MSc program as well. So I suppose that's provided a little bit of context about the city and the kind of university, but now we're going to have a little more detail in terms of the physiotherapy program. So the main aims that I'd like to be able to achieve by the end of this talk is just talk about the course structure to have an idea of what it's like, recognise that the really important part of the clinical placement and the career opportunities, but also provide clarity about the application process as well. But I think before we do that, I think it's really important to understand what is physiotherapy. There's maybe lots of different misconceptions or perceptions about what our profession is all about and what it might include. And sometimes that can be based around people associate our profession with certain methods of treatment. So it could be that you might think physiotherapy is very much about manual therapy, or maybe acupuncture, or exercise, or strength training, or chest clearance. So there's lots of different techniques that we might be associated with. But I think that kind of misses the essence of what physiotherapists do and what we are. This slide and this information I've taken from the Chartered Society of Physiotherapy. So that's our union, and that's an important part of physiotherapy for us in our development within this country. And they provide some clear definitions of what we think or what we understand physiotherapy to be. Ultimately, it's a science-based profession, and that's why we have lots of research based within it. And what we do is, when we manage and work with patients, we take what we call a whole person approach. So it's not just about thinking if I have pain in the elbow and focusing only on the elbow. We need to think about what's happening with that individual person as a whole, how their condition and their elbow, for example, might be affecting them. That might affect their health, their well-being, and their general lifestyle. So it might stop them doing things that they like to do, and might stop how they enjoy their life, and ultimately have an impact on their quality of life. So what we're trying to do is really take kind of a whole person approach to understand that person as an individual in front of us in order to tailor the appropriate treatment. And ultimately, at the core of what we do is we want to be able to get patients involved in their own care. So we want them to be able to have empowerment, to have an awareness of how they can best help manage their own condition, and give them all that kind of power. And we do that through education. Yes, we use treatments and approaches to help support that, but ultimately we want to give people empowerment. And I think that's quite an important thing. And that's why I think it's a bit of a problem to kind of almost define ourselves by the treatments that we might use. The treatments that we could use, as I said, can be massage, manual therapy, acupuncture. There's lots of different things that have been used. But again, ultimately, those are just different tools in which we can help people. And again, we need to be kind of thinking about the whole person. And I think that's a big part of what we do here at Northumbria, is we spend a lot of time about understanding the patients in front of us, about their individual needs, their concerns, and their expectations, and use all of that to come to a tailored approach in order to support the patients. And that can be in any part of physiotherapy, whether it's musculoskeletal, neurology, wherever. We really want to be able to empower the patients as best we possibly can. And as I said, we use lots of different skills and knowledge to try and help patients. And what the beauty, I suppose, one of the big strengths of physiotherapy is the breadth that we can work in. So all of the different conditions and systems of the body we can have an impact on and support patients through. So kind of traditionally, we think about neurology. So that's a key area for physiotherapists to work in. So this is not limited to, but provides a few examples of some of the conditions that we might start to work with, whether it's stroke, multiple sclerosis, Parkinson's disease. My area of practice is musculoskeletal physiotherapy. That's where my background is. So we look at kind of things like spinal pain, joint pain. We can think about kind of chronic pain. It could be linked with sports injuries. It can be linked with arthritis. So there's a whole host of different areas of kind of conditions that might be under this kind of area of practice. We also work with cardiovascular kind of populations or kind of system and patients that have an issue or a problem with their cardiovascular system. So examples of this might be chronic heart disease, heart attack, for example, and the following rehabilitation to support those patients from such an event. Also within respiratory physiotherapy as well. So we think about conditions that could be, for example, as asthma, COPD, cystic fibrosis. But again, this just provides a very, very few kind of examples of the breadth of where we work. In terms of, in reality, the amount of different conditions that we might work with in clinical practice is way, way wider than this. And we often might see patients with a combination of some of these conditions. So we have to be able to deal with complexity. And that's certainly something that here at Northumbria on the Master's Programme, we have a module based around kind of managing and dealing with complexity. I think just before we move on and get a bit more details about the programme, I think it's important to recognise that about the accreditations that we have within the UK. So our programmes, both the MSc and BSc, are accredited by the CSP, which is the Chartered Society of Physiotherapy, which is our union, and then the HCPC, which is the Health and Care Professions Council. That is a vital part of our programme to be accredited by both of these. In order to work as a physiotherapist and be registered appropriately, you need to be registered with the HCPC. And because our programs are accredited by both of these organisations, as soon as you finish the programme, you'll be able to be accredited straight away to work and get registered with this HCPC. Because if you are not registered with the HCPC, you are unable to work as a physiotherapist because it's a protected title. So again, both of our programs here are all accredited by both the CSP and HCPC. It's also, I think, important to know that all of our staff, myself included, we are registered with both of these kind of government bodies and are also the clinical educators out on placement. So we all work together, we all have similar expectations and all have the similar kind of professional identity as well. So I think before we kind of look at the MSc in a little bit more detail, I think it's important just to have a little bit of context about how people typically qualify as a physiotherapist within the UK. So the typical way, and I think the most common way in terms of just broad numbers across the UK, would be the typical route of doing a BSc degree in physiotherapy. So that would last 2 years. Typically, that might be students, we'll say you've finished school at 18 years old, finished their, for example, A-levels in the UK, although there's a range of different entry requirements that we like to have. So it's not just based entirely on A-levels. We like to be inclusive as possible. So there's a range of different entry options for students. But typically in the BSc, Traditionally, they're typically a bit more younger, around 18 years old, and they've continued through all of their education. However, having said that, we do have students who are a bit more mature, maybe haven't studied for a while and feel more confident to do the BSc program. However, the other option that we have within the UK is the master's program. So that's a pre-registration physiotherapy degree. So what we mean by pre-registration is that the person has done a prior degree and got an equivalent of a 2-1 in their specific subject, but they have not done a prior physiotherapy degree. So if you've done a prior physiotherapy degree, you wouldn't be eligible to come onto this current program. And that's why it's pre-registration. If you already got a degree in physiotherapy or equivalent and you wanted to do a master's, you need to do a post-registration master's. They are available in the UK, but again, that's slightly different for what we're talking about today. Ultimately, the BSc program takes a little bit longer, it's a year longer, whereas the MSc is condensed into the course of 2 years. It's assessed as a slightly different level because it's master's level, that's equivalent to level 7 within the UK, whereas the highest kind of level for the BSc when you finish with your degree is level 6. And the philosophy of the program at the Masters here is slightly different. So we very much base a lot of our teaching and learning around what we call inquiry-based learning. So there's a big focus on students to investigate, problem solve. So we do a lot of work around kind of case studies and give those as like a bit of a challenge. Students go away and work together in order to try and work out maybe what the diagnosis is, how maybe to help this patient. They'll do some research on a range of different conditions together, and then they'll kind of come and present their findings with staff, and we start to discuss them in a little bit more detail. So in terms of it, there is, I suppose, that's where a big difference between the MSc and BSc is the style of teaching. It's a little bit of a slower pace with the BSc because we have longer to do it. In the MSc, the pace is a little bit increased because we have to cover more content in a shorter period of time, or more concepts in a shorter period of time, I should say. The other, I suppose, difference is that one of the key modules is a dissertation or a research-based module, and research is heavily built all the way through the master's program. It's very important on the BSc program, but the research component in terms of engaging with research straight away is probably a little bit more preeminent within the master's program. And it'll be the dissertation is where you will be actually conducting your own research as well. That doesn't necessarily occur in the BSc program. So what does the program actually look like? So I'm going to kind of break things down in terms of the modules and then the placements, and then we'll think about some of the key important areas in order to get onto the program. So in a nutshell, to keep things really, really simple, is that we have 7 modules over the course of 2 years. In terms of how we assess you on the individual modules, there's 2 modules that will have a practical exam with a bit of a viva component. We have 2 presentations with a viva, so you'll be presenting your understanding of a case study, for example, and then after that, we'll be able to ask you questions about your decision making and your reasoning and things around that. There are 2 written essays, so academic writing skills is an important part of the master's program. And then finally, you have 1 dissertation, which is a 10,000 word piece of work, which will be written up in the style of a journal article ready for publication. Students who've done this module in the past, not all, but certainly some, have actually went on to publish their work from their dissertation. And that's certainly something we'd like to encourage for all people who are doing, for everyone when they're doing their dissertation. In between the modules, as we have 4 clinical placements, and those are spread out the course of the 2 years. And then you will do a minimum of 1,000 hours of placement time over the course of those 4 modules, those 4 placements, I should say. In terms of like the teaching and the assessment, so how do we kind of teach and what does it look like? Ultimately, there are, like I say, the 7 modules. Most of those are worth 20 credits. However, the dissertation module is worth 60 credits. And in total, you'll end up with 180 credits for the MSc. And again, that's spread over 2 years. In terms of the modules themselves, in terms of that direction and what they're based on, some are a little bit more academic in nature. However, all will have elements of practical and skills tied in with them. How they're delivered is we do have some lectures, but those are certainly kind of in the minority where we're just speaking to students and giving information. The masters, we spend a lot of time in terms of workshops and seminars. So that's where we're working a lot more collaboratively around case studies, in terms of different challenges and reasoning and doing research. So again, I suppose that's where there's a key difference on the whole, maybe with the BSc, is that we spend a lot of time in workshops here on the master's program. A lot of people ask me, how much teaching per week is that, like as in terms of direct taught content? And it's really difficult to kind of provide a bit of an average, and I'll talk about why that's the case in a few minutes. But ultimately, you can up to, maybe when it's a really busy week, you might get anywhere between 14 up to maybe 20 hours worth of direct teaching. But this is all dependent on what time of the semester you are in, and also what modules are ongoing, because how the program develops, it undulates a little bit in terms of when the teaching's on. Typically, though, you will be expected to be studying full-time, so while you might have less than 14 hours of direct teaching per week, it might be a little bit lower than that, is the amount of work and preparation and study and investigation required will certainly mean that it's a full-time program. So you will be expected to be doing around 37 hours of research and preparation per week. While you're on placement as well, you will be working full-time as you would in as a physiotherapist job. So typically 8:30 to 4:30, and that'll be 37.5 hours per week. Some placements might be a little bit start earlier or kind of start a little bit later, but again, that's all based on individual placement requirements. In terms of the assessment, as I said, we don't like to do just one type of assessment. We like to mix things up, because physiotherapy isn't just about writing essays or being able to remember things. That's not a fair reflection of what we do. So we have a range of different assessments. So there are about, like, say, 2 written essays where you will be doing some research and answering some kind of questions. We have 2 presentations. So a good example is one of my modules, where I will give you a case study and you'll have to work out the diagnosis of what's happening with the patient and present a plan of how you will treat and manage this patient. So you'll present that as a presentation for us, and then we'll also have a viva where we will kind of ask questions about your decision making, why you thought the diagnosis was correct, for example. So we'll really get to understand some of your clinical reasoning and decision and making approaches. There will be a little bit of reflective kind of portfolio work when you kind of collecting what you've learned over the course of the years. We do have practical exams, which is a key part of the assessment. So you'll be working in the clinical skills centre and actually working with patients or models who are acting as patients in order to assess and treat them. And then the other key area is your placements as well. So you will be assessed while you're on placements using something called CPATH, which is our kind of clinical assessment document, which has been developed by the CSP. The other thing is you have your dissertation. So this is where you will be doing some research yourself and conducting it and writing all of that up as a big kind of like journal article as well. The other thing, just so I'll talk a little bit more detail in a few minutes, is that our placements, we provide 3 of the placements out of 4. And then on the 4th one, which is the last one, which is called your elective, you can choose where you would like to go for your placement. So because we organise the prior 3 and sort all of that out for you, there might be an area where you are really interested in and would like to go back there. You can use your elective to do that. If there's an area that you have a lot of interest in but haven't had an opportunity to go there yet, then you can use the elective to kind of fill that gap. We will help you in terms of the elective placement and support that, but we won't dictate where you go, whereas the previous 3 placements, we will allocate them for you and source them for you. So in terms of the actual 7 modules, what are they and what do they look like? So I'm going to provide a bit of a brief overview of the 7 modules that you'll have while you're here at Northumbria. The green row, or the light green row, I should say, are all year 1 modules, and then the kind of darker green those are year 2 modules. So we'll kind of talk about the first year initially, and then we'll kind of cover the second year in a little bit more detail as well. So the first module that you'll come across is Foundation Skills for Physiotherapy Practice. So this is really quite an important module. It's the very first one that you have. What it starts to introduce students to is the fundamental skills needed to be a physiotherapist. So that would be looking at assessment of movement, thinking about the basics of assessment of patients, thinking about how we move and transfer patients safely, and using various different equipment. So that means when you go on your first placement, you're going to have some basic skills where you can have an input with clinical practice. So it'll be a case of, you can go on placement and be able to help transfer patients, start the basics of an assessment, communicate with patients, for example. But also this module is quite important, not just for the placement, but it really starts to introduce students to this inquiry-based learning, where we use lots of different case studies or a range of case studies in order for you to, as students, to get used to this approach of inquiry-based learning, which will feel a little bit different from what people are typically used to on a degree. About 2 or 3 weeks after the start of this module comes this one, which is Management Skills for Physiotherapy 1. So this is my module that I happen to lead, and because my background is in musculoskeletal physiotherapy, and that's where the main focus of this module lies. So we'll be looking at how to assess both subjectively and objectively patients for musculoskeletal conditions. We'll be kind of covering theory or understanding around the concepts of red flags to make sure that we are able to, or adequately and safely, be able to kind of pick up any serious conditions or the potential of serious conditions with patients in order to manage them appropriately. But also we'll introduce other concepts, not just limited to, but exercise prescription, pain, manual therapy, neurodynamics, for example, goal setting, values-based goal setting, and we'll be basing this around something called the biopsychosocial model, which is quite important for this whole person approach that I mentioned earlier on. So that will take you all the way to the first summer, and then at the end of that summer, you'll have your first assessments within these 2 modules. And then you will go on placement. Once you've finished placement 2, and I'll provide a bit of a diagram of what the whole program looks like in a bit of a chronological order, is you'll come back from your second placement and then you'll go to Management Skills for Physiotherapy 2. And this has a bit more kind of a hospital-based kind of approach in terms of acute assessment for around cardiorespiratory, cardiopulmonary assessment and neurology assessment as well. So this is going to give you skills to work within particularly the wards or within a hospital. So thinking about things like early mobilization of patients, surgical patients, patients in critical care, thinking about concepts, not limited to, but include prehabilitation, looking at concepts around oxygen therapy. But ultimately, this module is really based around clinical reasoning, decision making, and putting that into practice using the skills that you'll be taught within the module. And that is a practical exam that you have where you'll be working with a model patient. While this module is ongoing, you'll have another module working alongside it, and this is physiotherapy for health and well-being. So this is kind of looking at some long-term conditions and going a little bit more detail around areas or concepts around pain, physical and mental health. We'll be introducing a little bit more detail around concepts around rheumatology, fatigue, and we will be kind of overlapping a little bit with neurology assessment and management, but also conditions such as COPD, pulmonary rehab, and really think about behavior change and how we work with a patient as an individual. So you'll see there will be a little bit of overlap between some of the modules. They're not necessarily mutually exclusive. Each module will support other modules. So there'll be a bit of dovetailing or interlocking between some of the concepts there as well. Because ultimately, at the end, we're learning to be physiotherapists, not a musculoskeletal physiotherapist or a neurology physiotherapist or a respiratory one. We all have a lot of kind of common skills and transferable skills, and you'll see that kind of blends in throughout the course of the program. After you finish these 2 modules, you will have a Christmas break for about 2 weeks, and then as soon as you come back early January, the first week of January, you'll have your exams for these 2 modules. After that, you'll go straight on to placement for placement 3, and that will take you until the spring of your year 2. And once you come back from those placements, you'll be introduced to a new module, and this is physiotherapy in complex contexts. So again, this is looking at a range of different conditions, but thinking about in the context of complexity and dealing with complexity, and starting to think about clinical reason, decision making, and starting to ultimately be introduced to more complex conditions or contexts, so you're kind of able to deal with this or start to kind of make those first few steps towards dealing with complexity to help with placement as well. So we'll cover a range of different conditions and details in and around that, but it's in the guise of the concept of complex contexts. Then you will kind of move on to your second to last module, which is, well, I suppose ultimately this is actually the last module in many ways in terms of taught content. So this is innovation, leadership, and preparation for work and life. So this module is ultimately about preparing you to be employable once you finish the program in the January. So we'll be looking at different concepts around leadership, thinking about quality improvement, political awareness, understanding some of the healthcare systems and the environment, digital innovation. We'll have some kind of additional masterclasses in terms of teaching there as well. So ultimately, this is about preparing students ready to be employable at the end of the program. While you're in year 2, the other module, which I haven't described too much, is your research module. So that would be your dissertation. So basically, you will have a year to develop a research question and start to answer that, either collecting data. You can do empirical work, where you might be in a lab potentially collecting data, or you might do more of a paper-based research work, for example, a systematic review, and that's where you'll kind of think about looking at an answer from a theoretical perspective and putting that into research in terms of a systematic review. And again, we have had students who've published those as well. So there's different guises and different approaches that you can use your dissertation for, and that's certainly something that we discuss before you go out on placement at Christmas time, before the start of year 2, just so you make the most of your time ready to develop your research question. So this diagram, I suppose it's not the easiest to put together in some ways, but it's just to give you a bit of a feeling of exactly what the program will look like when you're on it. So between January when you start and then to early April, you have your first 2 modules. So the foundations module and physiotherapy skills module 1, and they are spread over about kind of 4 months. And then you go on placement for 7 weeks. That's your very first placement. And as soon as you come back from that placement, you will have your assessments for both of these modules. You'll get a little break around the August time, and then you go straight onto your next placement, which will last 8 weeks. And that will go all the way through into October time. And this is when you'll start your second 2 modules. So physiotherapy skills 1 and PT 7002, which is the name, was physiotherapy for health and well-being. So when people ask how many hours of teaching per week I have, and I say it's actually quite difficult to describe, this diagram kind of shows why. We have 2 modules here spread over the course of 4 weeks. So each week isn't quite intense in terms of face-to-face teaching. But because these 2 modules are spread over the course of about 7 weeks, the amount of teaching per week will increase just because it's a little bit more intense or a bit more dense in terms of the teaching contact time. So again, that's where it's a little bit, it'll feel a lot more intense in terms of the teaching at this time, just because of the condensed nature. You will have a quick Christmas break, as I said, have your assessments in very early January, and then you go out on your 3rd placement, and you will come back to university in April, where you start your complex physiotherapy and complex context around the April time. At the same time, you'll start really in earnest, start your dissertation module, which is this blue one here. You'll have your initial assessment for PT 7004 in June, and then you'll go off in your elective or final placement for 6 weeks. And then in September through November, you have your preparation for work and life modules, the innovation module, and that will take you to December when you have your final presentation, and then you will submit your dissertation in December. And that ultimately is the 2 years in a nutshell of what it will be like. However, the placements are a real important part of what we do here at Northumbria. So we have, as I said, 4 placements. So in year 1, you've got 2 placements, and they last 7 weeks in placement 1 and 8 weeks in placement 2. And then in year 2, your 3rd placement lasts 8 weeks, and your elective placement is 6 weeks long. In terms of geographic location of where we are, so this is Newcastle here, and you can see the main conurbation. So the majority of our placements are based around what we call, well, obviously Newcastle and Gateshead, which is a town on the other side of the River Tyne. So a lot of our placements up here, but also in this area here, Northumberland, we have placements there. So theoretically, you can go as far north as a place called Berwick, which is on the Scottish border, and we often use a hospital called Hexham General Hospital, which is about 20 miles from the city centre of Newcastle. All of these are available to commute to by train or by bus. So while we try to keep the travel for students limited, our preference, what we end up not always being central Newcastle, and that's because we want to use all of these excellent placements that we have. Hexham provides excellent placements, so does Berwick. And so does up around here in a place called Ashton, which is an important hospital there as well. So we really want to utilize good quality clinical placements. That's our priority, to get a broad experience of physiotherapy with the best quality placements. If that means students have to travel a little bit further for it, then that's absolutely fine. But where we try to kind of limit travel is that maybe you'd only have one placement that has a little bit of a longer travel. So it just makes things a little bit more fair more than anything else. So yeah, that is typically kind of our patch of where we will use placements. We don't use any placements actually in Scotland. We used to use Carlisle, which is over into the East Coast, but we'll rarely use that now. It's been a long time, but it's theoretically, it potentially could still be used. But typically we like to keep our students relatively close to the city of Newcastle or the Tyneside region at least. So again, most of the placements are in and around that, but all of the placements are commutable by public transport. And I think that's a key point to get across there as well. I suppose the other thing is that we are really lucky in that within a very small radius, we have some excellent hospitals. So just near our Coach Lane campus, we have Freeman Hospital, which is about 1 mile away from the campus, give or take. Closer to the city centre, we have the RVI, across within Gateshead, so about maybe 2 or 3 miles across the river. There's another very big hospital. So within a very small area, we have some excellent teaching hospitals that take a lot of our students. We're very, very lucky in that regard. Other parts of the country, the commute can be a lot bigger, so we are quite lucky in that regard. The vast majority of placements are within the NHS. We do use some private providers as well, and also some charities in addition to that. All of our placements that we use, this is where we source our placements from, they reflect the really broad spectrum of where physiotherapists work and where our profession is based. So vast majority of it is clinical practice, but we do have placements that have quite a big research flavour to them. We'll have some that are based around education and leadership as well, but as I said, the vast majority is clinical and based within the NHS. All of our educators who take you on and look after students on placement have completed our clinical educators course, and we work very, very closely with the local trusts and clinical educators to make sure the quality of support and the consistency of support that students have on placement is there and is like I say, consistent and effective for students as well. And the vast majority, or a huge proportion of our clinical educators were once upon a time students at Northumbria, so we know them very, very well and have either taught them or worked with them as well. So again, the links between clinical practice and university are really quite clear. As I said earlier on, the elective placement that allows you as a student to kind of choose where you'd like to go, what area of practice. So it could be an area that you have a lot of interest in, an area that you haven't been to, or maybe a part of the world that you'd like to go as well. So some students do international placements there as well, and we can support you in that endeavour to get that kind of elective placement as well. Opening your future as a physiotherapist who's just qualified, I would say, is really quite bright. You're going to be in a privileged position whereby you can make a significant difference to the quality of other people's lives. And I think that's quite a gift, certainly something I feel as a gift as a physiotherapist when I work clinically, is that I'm able to try and help people as best as I possibly can and hopefully change their lives for the better. I think that's a gift that we have as physiotherapists. I think we have responsibility to do the best job as we possibly can for patients. And again, I think it's certainly a privilege to be in that position. So again, I think your future can be very, very bright, not just in terms of that you're able to help people, but also I think where you end up working as a physiotherapist. The breadth of the profession is very, very wide, and you're never going to be bored as a physiotherapist. There's always going to be opportunities to continue to develop your career, your understandings, your specialities. So there's lots of different prospects here. So in terms of like the big, I suppose, employer within the UK is the NHS, but again, there's lots of different other areas physiotherapists work in. So in terms of like key areas, if you were to divide things up, maybe musculoskeletal is the one that I think, on the whole, is a bit of a stereotype most people might know about a little bit more. But again, it's only a portion of the profession. So you might, I suppose, the stereotype of physiotherapy, which isn't a helpful one, I think on the whole, is just expecting that people run onto a football pitch and work within sport, for example. While that is physiotherapy, absolutely, that's not a kind of fair reflection of all of the different areas that physiotherapists work. So yes, there are kind of sports roles, but we do work in rehabilitation. There's something called a first contact practitioner, work with orthopedics, trauma, emergency departments, outpatients departments, inpatients as well. So musculoskeletal kind of conditions, there's obviously lots of them, a very, very wide kind of area of practice, but there's lots of different areas in which we can put our knowledge into practice from a musculoskeletal perspective. Much in the same way, if we think about kind of cardiorespiratory or cardiopulmonary or cardiovascular kind of physiotherapy. So we will work with surgical patients in critical care, intensive care units, for example, within cardiac rehab, pulmonary rehab, COVID rehab. So that was something that was certainly that we during the COVID pandemic, physiotherapists were working at the front line supporting patients who are very, very unwell. And yeah, we had a big part of helping out with the COVID, of the impact of COVID, not just acutely, but also subsequently since. Neurology, again, a big area of physiotherapy. So we work with patients with stroke, who've had head injuries, spinal cord injuries, Parkinson's disease, multiple sclerosis, to name but a few different kind of conditions that we work with. Some people, I don't particularly like this slide, if I'm honest, when we talk about special populations. I would personally argue every single patient that we see is special. They are unique, they're an individual, they're a person who has a family, so their needs, I think, are all very, very special. But I suppose when we talk about special populations, we maybe think about people that might have slightly different needs or different challenges from a clinical perspective. So maybe in terms of older patients, they bring different challenges and nuances, much in the same way with pediatrics when we work with children. So again, there's a bit of more specialist knowledge within that. Much in the same way with mental health, pelvic health, for example, physiotherapists work within palliative care, linked around kind of end of life care. Again, those are, I suppose, a little bit more specialized kind of areas. Or we can work in burns, plastics, and hand specialists, for example. So again, I suppose they're seen as like specialist populations. I don't particularly like the term specialist population because I say anybody who we see is special because we need to treat them as an individual. But again, I think those are probably maybe more niche areas for the want of a better description. And within where we actually work, as I said, NHS is a big, big employer, but there are kind of private sector as well that employ a lot of physiotherapists. Some people go self-employed to work at their own clinic, for example. But we also have students who've qualified who went to work in different countries, to work for charities. But also physiotherapy isn't just fully about the clinical aspect. There's the education aspect of it, but also in terms of research, and that is certainly getting bigger and bigger, where more and more physiotherapists are working within research there as well, and making a difference from the body of knowledge and evidence out there as well. But in terms of actual just outright location, we can work, I say, within the hospitals and outpatients departments, with doctors within the GP surgeries out in the community. So physiotherapy is so varied with lots of different opportunities. So I think the future is very, very bright for students who have qualified within a really varied profession. In terms of our kind of graduate prospects, as recently as 2023, certainly for the BSc program, 98% of our graduates are on highly skilled employment or study 15 months after graduation. I don't have the exact data for the MSc program, but the vast majority of our students are getting offered jobs very, very quickly once they've qualified. Might not necessarily be in Newcastle, but they'll have to travel, maybe go to different parts of the country. Some people go on to do further qualifications, potentially for like a PhD, for example. But again, ultimately, the end that all of our students that qualify from the master's program are very employable and do well in terms of employment as well. I suppose it's just important is that while we do have students who go and register to go to different countries, we will help support that in terms of providing documentation and things like transcripts, but the actual process needs to be managed and initiated by students to do the majority of that work initially. But we will support in terms of providing documentation and transcripts, just to help validate documents and things like that there as well. So it is a bit of a two-way process to help people if you are interested in registering out with the UK. And then kind of final few sides there, the application process. So I would strongly recommend that you go and follow the link to the MSc Physiotherapy website. If you just Google MSc Physiotherapy Northumbria, I think it's pretty much the first hit that you'll find on your search engine. So we provide a lot of detail about the process and what you need to prepare ready for an application. I suppose in a bit of a nutshell is that you will provide all of your qualifications and you will provide a personal statement, which is up to 1,000 words. And I'll talk about some of what we're after in that in a little bit. However, once you submit that and we look at it and scrutinize it, if we feel that it's appropriate, then we will offer you an interview. And then if you attend the interview and you're successful in the interview, then we will offer you a place, which is subject to some conditions there as well. But in terms of entry requirements, we now just we require a 2-1 and a degree in any subject. Traditionally, we used to keep it something related to health, or like, for example, we've had a lot of sports science students, for example, come in, or who've done neurology, for example. We've opened it up to be a bit more wider now, so it doesn't have to be necessarily a science-based degree. You will be required to do a DBS check, which is basically like a criminal record check, to make sure that, just in terms of safeguarding, to make sure that people who are vulnerable as in terms of patients aren't going to be kind of treated or managed by people who have maybe got a criminal record that would deem them inappropriate to be working with those populations. So in terms of English language requirements, we'll be kind of looking at a score of a minimum of 6.5 in terms of IELTS, in terms of written section, and a 7 in terms of reading and listening. However, all of the details for this are on the website, so I'd really kind of strongly recommend that you look at that, and that'll help support your application in detail. But I think it's some kind of top tips for making a good application is make sure you do your research. I can't really get this point across strongly enough. You need to understand what physiotherapy is, what it entails, where we work, and have a thorough understanding. You're making a decision potentially that will change your life in terms of the type of job that you work, the profession that you're in, but also where you might live. And that's a big decision, I think. So what we want when we're looking at applications, both within the personal statement, but also during interviews, is that people have made a really informed decision about what they want to do. So I think it's hard to just suddenly decide one day I'm going to be a physiotherapist and apply on that day, because the preparation in order to justify or understand why you want to be a physiotherapist will take a little bit longer with that. So ultimately, make sure, like you say, it's a big decision, have a really clear understanding about what physiotherapy is, but more importantly, why you want to be a physiotherapist. What is it about you that you think will help make a good physiotherapist, and why do you think that might be the case? What we will be expecting in applications, not only is a thorough understanding in and around the profession and why you want to be a physiotherapist, but that should be based upon gaining some shadowing experience. So not as a patient yourself, but what we're looking for is people who have shadowed and worked with physiotherapists to gain some direct experience of what the profession is like, and to understand that as best they possibly can. So I think that's really quite important. We're also interested in understanding your engagement with research. The master's program, like I say, is heavily kind of focused towards research. So what we will need is, within the application is a recognition of how you've engaged and worked with research. But again, I'd really kind of direct you towards the website. There's like 2 or so sections that we talk in detail about the application process, but also the expectations of the personal statement. So I'd really recommend that you take some time to really look at that, really think about where you are in your journey, ready to apply for the program, and make sure basically you cover all of the bases. I think that's a really important point there. And I suppose things to really kind of think about, in your application is that you're going to be, going to a different part of the world potentially, and a different part of the world that you might not know too much about. So I think having awareness of where you're going and what that's going to entail in terms of the experience, the university, I think is important. But also the healthcare system of what you're likely going to be working with, and have an understanding of that. And I think ultimately, what you want to gain from your qualification, how are you going to make the most of your qualifications? I think being really clear on that is always going to be helpful. And I wouldn't just say this if you're looking to apply for Northumbria. Obviously, I'm really biased. I think the Northumbria program is a very, very good one. But again, I would recommend looking at other programs as well that also do the master's program. because it's going to give you an informed decision about what feels right for you. And I think that's what's important. As I said earlier on, as physiotherapists, we really care about the well-being and take a whole person approach to when we treat patients. But I would also say the same of the staff at Northumbria, is that we really get to know students individually and want to be able to support them. And I think part of when students do well here is that they understand what the program is like, and have a bit of an understanding of what it's like to study here as well. And I think that can be enhanced in understanding what it's going to be like by looking around the other programs and see how they're different, or maybe where there's similarities. So ultimately, I just want to make sure that you've made an informed decision and you understand exactly why you're applying to the program, and why you want to be a physiotherapist as well. And because it just shows that you're making an informed decision, because it is ultimately a big decision to potentially travel across the other side of the world and have quite a big change to your life, because we want to make sure that you are happy, well supported, and make the most out of your qualification. And that ultimately your well-being is a really important part for us as a teaching team, certainly as a program lead, to make sure students are happy. And it's not just about surviving. I want students to thrive and make the most of their experience here, not just at Northumbria, but also within Tyneside, within the region of Newcastle as well, because there's lots to offer and there's lots to enjoy and make the most of as well. So that is kind of my presentation there on the whole. I'm just going to stop sharing there. So hopefully that's provided a little bit of information about the program. I appreciate, hopefully my accent is clear enough to understand. I'm trying my best to hold back my Geordie accent a little bit there as well, particularly when I've been speaking for nearly 40 minutes or so. So hopefully that's kind of come across clear enough and provided some information about the program. So if there's any questions, I'm more than happy to take those.
Thank you, Michael, for your very in-depth presentation. I really know more about physiotherapy as a program, as well as how we should apply to the program strategically, because I think most of the students, they probably have a different background coming across, like accounting and finance, as I mentioned before, and those who have a sports science program, a specialty degree, who like to get a licensed program like physiotherapy in the future. So very useful information and very clear explanation about how the program is going to structure. Really appreciate for your time to explain to our audience today, our potential clients, to apply for your program. But I have one question that I really bear in mind from few of my applicants would like to ask. Should age be a concern as an applicant for the program? Because obviously having a degree done previously, let's say 10 or 20 years ago. Yeah, age be a concern, because I've read some of the entry requirements from university offers in the UK as physiotherapy program, master level. They mentioned like 10 years that you should apply within the time you complete your program. Should that be a concern as an applicant for
I mean, it's not stipulated, so I don't have a massive concern with that. I think it's ultimately is part of, I suppose, the decision is if people have been out of education for a while, it's how they may be preparing themselves to come back into education. I think that would be something to be able to kind of articulate, certainly maybe within a personal statement. How have they started to re-engage with learning and maybe engage with research, for example? So that will give us a bit more insight in terms of how prepared people are. And I mean, there is, if somebody is really, we sometimes find this with students that haven't been in education for a long time and are a bit more mature. Some elect to do the BSc program because the pace is slightly different, and then that's kind of more tailored, a little bit more tailored towards them. But again, on the whole, in terms of age, on the whole, it doesn't really matter for us in terms of, because I think older patients have older students, I should say, bring life experience. And I think that's still a really valuable thing on the master's program as well. So they might have seen a range of different things in their lives, experienced different things. The master's program is really quite a close-knit cohort. We'll typically have about 15 up to 20 students per year group. So it's really quite a small cohort, and they get to know each other really well and support each other through those 2 years, because it's relatively intense. So again, sometimes having patients who are a bit more experienced, got a bit more life experience, that's actually quite a positive on the whole. So I certainly don't have any major concerns. As far as I'm aware, we don't have any stipulation about how long your previous degree was or when you completed it. But again, I think if there has been quite a bit of a gap, I think it's recognising of applicants to recognise that there might be a challenge around that, but what are they doing, or what have they done to kind of almost overcome that bit of a challenge more than anything else.
Yeah, this is brilliant explanation. So I guess this message is very important for a couple of my applicants because they're at the age of around 40, 45, 60. So yeah, they're quite older, but they would like to get something done in the UK. So very good, very good, very good. I hope this message finds everyone as well. And that just jumps to the last part of the presentation today. So I'll explain.
Oh, okay, hold on.
Yep,
so
sure.
I see there's a question coming from the chat box. One student say, I don't have a science background and my bachelor's is in bachelor and master arts degree. So is he qualified?
Yeah, so at the moment we're opening up to anyone with a degree as an equivalent of a 2-1 in the honours degree. But I think it's just recognising that there will be a bit of a difference. It will probably be, if you haven't had some experience within science, it'll potentially be a bit of a steeper learning curve. But what we have found is that this is the first year that we've opened it up. I think it's the second year that we've opened it up to any degree. But again, I think it's understanding what preparation you would be able to do as an applicant to ready to start to adapt to a very scientific-based program.
Okay, thank you.
Okay, if that is clear, I'll explain a little bit further in terms of the entry requirement and wrap up about the registration part for as a physiotherapist coming back to Hong Kong. So just allow me to compromise this in Chinese. So咁大家如果啲問題有關於個收生標準啦，其實一般嚟講，佢係需要大家學生有一個 2-1 嘅 degree 就 OK 㗎啦。基本上佢係冇任何嘅 background 要求嘅。咁所以其實如果我係好似有啲 applicants 佢話我係讀一啲 business background 嘅，我想報呢個 program 得唔得啊？最主要其實大家個 first degree 個分數達到佢哋嘅 2-1 呢個要求就可以㗎。喺香港嘅 terminology 就係話 second up 咁就冇問題㗎啦。咁另外就係好似頭先阿 Michael 有講到啦，就係去考翻 IELTS 啦。咁其中一個 component 就係6.5，others 咧就係7.0嘅。咁同埋佢亦都講到啲面試啊 personal statement 要大家要 draft 啦。咁所以其實喺呢個 application 上面都有好多 strategy 大家要準備，同埋要真係好似佢咁講 rethink about why you like to apply for physiotherapy。OK， 咁落到去可能有啲學生亦都問過嘅，翻香港執業點搞，同埋有啲咩要注意啦。咁其實最重要就係話完成佢個 postgraduate program 啦，因為佢呢個2年嘅 program 唔需要任何學生有任何嘅 scientific background 嘅。咁所以當你完成咗呢個2年制嘅 master 啦，同時喺佢哋嘅 clinical placement 裏面，大家只需要完成1000個鐘頭嘅 placement hours， 攞晒所有嘅 certified 嘅 certificate， 喺英國首先做一次執業嘅註冊先。咁英國嗰 part 都幾快嘅，但係完成晒所有嘅 registration 翻嚟香港帶埋所有嘅 transcript， 咁就可以完成埋香港嗰 part 嘅註冊嘅。但係香港嗰 part 嘅註冊咧就 take place 比較耐嘅，因為佢係通常就大概需要3至到6個月先至搞得掂，因為佢要 verify overseas 嘅 qualification 啦，咁同埋要 verify 嗰個 working hours 啦，咁所以其實都嘥少少時間啦。不過Northumbria呢一個 master program 咧，佢係按香港嘅呢一個物理治療師委員會註冊 qualification， 所以大家只需要問我攞翻個 codable qualification 個 list， 咁我就可以提供俾大家噶啦。咁同埋要留意翻啦，申請嘅時候要做面試嘅。點解要做面試咧？因為其實當大家讀呢一科嘅時候 ，instead 佢話除咗教之外，亦都有 placement 嘅呢一個含量喺裏面啦，所以變相就會帶大家去到醫院或者 clinic 裏面去做大家嘅 placement 嘅。咁所以其實當大家讀嘅時候，變相有一半 component 都需要去做嘅。咁所以咧，大家要留意翻，如果係中意讀呢種 program 嘅時候，面試係一個好重要嘅 component， 就係要理解我呢個學科係咩嚟啦，要有相對嘅經驗，可能就係話OK， 我自己冇做過相關嘅嘢，但係喺申請之前要考慮翻有冇任何接觸病患或者照顧過病患或者照顧過有需要嘅clients 啊，或者可能係屋企人咧，咁亦都可以 demonstrate 到我哋唔驚去接觸任何嘅病患嘅。因為比較驚嘅地方就係話，我入到去讀嘅時候，啲學生話原來係要接觸老人家嘅，要接觸啲後生嘅，或者甚至乎要接觸一啲好年輕嘅朋友，咁我唔知點樣同佢 communicate 啊，咁就會令到個申請嘅時候喺面試個 part 咧做得唔夠好嘅。咁所以要留意翻喺呢一點需要 explain 到啦。咁亦都要理解到 NHS 佢哋嘅 core values， 即係可能有時我同學生 生做面試 training 嘅時候，就話俾大家聽，呢一個係一個叫做 code of service 嚟嘅，到底點樣對我哋嘅 clients、我哋嘅 patients 啦，呢個都係非常重要嘅。咁另外可能就要講到自己對呢一科嘅價值觀同埋未來就業嘅呢一個方向啦。咁所以其實喺面試嘅時候都好多嘢需要大家去 explain 到同埋講得清楚，咁樣佢哋就會可以做個收生。亦都好似 Michael 頭先講啦，其實佢可能大概15至20個學生嘅 capacity 都係非常少嘅，咁所以做申請嘅時候就要大家要留意翻 personal statement 同埋面試啦。咁我相信喺呢度聽得呢個 talk 嘅各位都係唔會年輕㗎啦。咁所以呢啲面試通病啊，咁通常都係 English training 同埋做翻好個 presentation 啦。咁所以其實呢啲我會話可能就係講 values 唔夠熟啊，或者冇足夠嘅 caring 經驗啦，咁就會令到個 interview 嘅表現唔夠好。咁大家留意呢啲點呢啲位置啦。咁落到去最後啦，咁如果真係大家有需要去申請嘅 individually 可以 PM 我或者係 WhatsApp 我都 OK 啦。咁我會同大家做啲面試嘅培訓，咁 make sure personal statement 嗰啲亦都係 legit 同埋做得靚仔啦，咁就去報名做申請嘅。咁落翻去 chat room 我都見到有啲問題啦，just wrap up some of the questions like people keep asking about they don't hit the entry requirement of 2-1. So could you consider a 2-2 program? Could you consider a student with a 2-2 background?
I'll have to double check with that one because like you say it is the 2-1 that we're looking for. They might have a master's afterwards, but I'd have to double check them because I think most people have kind of come on that we've had in the past that have just getting the 2-1. So I'd have to get back and double check about if they've got a master's afterwards.
Right. I can keep tracking about this program. Last year you were taking 2-2, but obviously about 2-1 this year. So I'm afraid if you ever just have a 2-2 degree, please, I do encourage students to apply. It just really depends on what else you've done after your degree. Let's say you're doing a master, any professional diploma, or any work experience that could count as part of the health science program. So I do really encourage students to get the whole pictures of the education background and the experience, so that for whole consideration from the faculty.
Michael, there's a question about whether we have any quota for this program for international students.
Any protected spaces, was that the question?
Yeah, I mean, it's like, do we have any, like, how many students we can accept or consider for from the international student onto this program?
So we don't do it by a number for international students. It's open, so we have up to about up to 20 places in total. It will change a little bit each year, but again, we don't have a quota necessarily for how many international students. We just take it to come as who applies, and if they hit the criteria, and once the program fills up, that's when we'll kind of stop recruiting. So whether those are international students or otherwise, that we don't have like a protected amount of international students. Not as far as I'm aware anyway.
Okay, thank you, Michael.
Any more questions? Well, I've just dropped my WhatsApp number in the chat room. So if anyone else who have questions, please do feel free to have a chat with me privately, so I could address you to apply. Can I apply now for September 2000? Okay, just let me explain these questions on with Cantonese. 因為其實 Northumbria 呢一間大學佢哋係2026年1月開學，所以大家留意翻啦，佢哋就冇9月開學嘅，咁所以我 anticipate 個 next entry day 應該係2027年1月嘅。希望解答你問題。Woody 有個問題就係 Is the application process on a rolling basis? Oh, there's a question from one of my applicants. Is the application process on a rolling basis?
Yeah, so at the moment the window is open. So if you wanted to start in January 2026, you can start to apply now. And we will keep interviewing and looking at applications up until the program is full. And then once we are full, everything will close. The program will start in January. And then in a year's time, we'll reopen the process for the next cohort.
所以其實係有 rolling system 嘅，因為其實佢哋個學生收生嘅人數都唔係特別多啦。咁特別係英國嘅呢一個申請階段嚟講咧，通常都會係 first come first serve 嘅。咁所以我都會 encourage 學生，如果我哋係睇緊呢一個2026年1月開學嘅話咧，咁都係盡早報名啦。因為今年佢啱啱就4月份先開始接受申請嘅，咁所以其實已經有 applicants 開始報名嘅啦。咁所以大家如果係未正式報名嘅，可以同我傾一傾，然之後去 apply 翻個 program 啦。咁早少少可以 secure 到個 application 啦，咁亦都係早少少會學校嗰邊開始 proceed 個application 睇 personal statement 啊，睇成績 CV，咁然之後安排 interview 嘅。咁所以我都會 advise 大家係盡早去 arrange 個 application 為主咯。Okay，so 如果大家未有特別嘅問題啦，咁 again 我將個 WhatsApp number 我都擺咗喺個 chat room 嗰度嘅。咁如果大家有啲咩問題，可以隨時去 PM WhatsApp 我就 OK 噶啦。I guess that's everything for today. So thank you very much for Michael's time. Very, very rich presentation about the program and the tips about the application. So hopefully we can help out to recruit students for Northumbria. Thank you very much, Gary, and thank you very much for everyone participating.
Okay, thank you very much. Have a good day, good evening.
Thank you, everyone. Thank you.
唔該晒大家 ，thank you，thank you。有啲咩可以隨時 WhatsApp 我傾一傾。Thank you, Michael.